for me, please. What we thought we'd go through today is just a little bit of University of Chichester and sports therapy, and just a little bit about what a day in the life would look like. And we've invited 4 of our second year students that you can see there under Nathan Jones, and we've got them to join us today. But what I will do is I'll just get each of us just to do a bit of an introduction to tell you who we are and what we do at the university. So I'll start with myself. My name is Vicky Davis. I'm Programme Coordinator for Sports Therapy. And I have taught at Chichester since 2003. So I've seen lots and lots of changes that have happened over to the university over the years, and sort of evolved as the programme has evolved. And myself and Carolina's been there for a year longer than me. So we really have been there since the sort of foundation of the programme. Carolina, do you want to introduce yourself?
Sure. Hi, I'm Carolina Muschiati, and as Vicky says, I've been here since 2002, and obviously our degree programme started in 2001, and so we've both been very much instrumental in the development of that programme, and it certainly has evolved. Yes. Would you like us to tell them a little bit about what we teach, etc.?
Yeah, just the modules that you teach, yeah.
Okay, sure. So at the moment I mainly teach at third year, but I have been involved in a number of the modules. But at third year, I'm responsible for the coordination of the sports injury teaching clinic and the clinical placement, which are obviously really key to the degree in your ability to actually go out and gain some clinical experience and apply the knowledge and the practical skills that you have learnt. So we run a clinic here in the within the university, and Holly, you probably would have seen that last week. It's next door to the teaching room, and basically it's run by the students, and it's open for staff and students to attend. They get free treatment there, and it's an opportunity for the students to actually practice everything with the supervision of the staff. So that runs over both semesters in your third year, and then we also have your clinical placement where you actually go out and find a placement, whether that be a multidisciplinary clinic or a sporting environment or a rehab centre, for you to go and gain some clinical hours. And then I teach on 2 other modules in the third year. One is manual therapy to the peripheral joint. So it's being able to mobilise the shoulder joint, the knee, the ankle, dependent on what we need to address there. And then I do a final module called Advanced Sports Injury Management, where we literally just will bring everything together. So we visit all the regions of the body and ensure that we just consolidate all the knowledge and practical skills to be able to deal with any injury as they present to you in the clinical or sporting environment. Okay.
Will I share Russ's? So this is Russ, one of the other lecturers, unfortunately is unable to be here. So here's a little something he prepared earlier. Give me a shout if you can't hear him.
Hello, my name is Russ Clash. I'm a lecturer here at the University of Chichester, where I've been since August of 2020. Prior to that, I have worked in private healthcare. I worked in professional football for 9 years as the head of medical at a professional football club in Hampshire. And previously, I was a member of the British Army, where I served for 23 years. So I had quite a long period of time to gain lots of experience in the world of fitness, rehabilitation and sports therapy. And I hope you enjoy your open day here with us today. Thank you.
Was that all heard all okay?
Yeah.
Yeah, it was funny. Just you didn't move around that much. So what we're going to do today is there are a couple of videos that we are also going to share with you, and we are aware of some of the shortcomings potentially of sharing videos over Teams. So what we're going to do is copy a lot of those links that we're going to be dealing with just into the chat box, just so that you can access those and then we can talk about those links. So Russell has come to us recently, and he's responsible for the acute injury and trauma module within your first year, also your soft tissue module, And then he also helps coordinate the 4th year integrated masters. So just a little bit about our MSci. Our integrated masters program is the only one within the country that offers a 1-year professional placement. Now that professional placement, you are incorporated into a team. So currently we have lots of places that are incorporated into football or rugby. Obviously this year has been quite challenging, but they have still been able to get the placements for this year. And you are seen as a member of staff within that professional environment. You then return to us every 2 weeks within your 4th year, and you have a day's content with us and then return back to your professional setting. This qualification is of master's level, but it is seen as part of your 4th year undergraduate development. The reason why this is quite key is it then comes under undergraduate funding. So if you chose to take this route, you could then, if you wanted to, also do professional level master's courses on top and still be available for funding. So it's a bit of a loophole that you can get round. Now with the MSci, it is a decision that you make at the end of 2nd year. So even though on UCAS that you are available to apply either for an MSci route or for a BSc route, you don't need to make that decision now. You can quite happily go on to the BSc route and then make that decision later on within your degree. Amber, would you like to introduce yourself?
Hello, so I'm Amber. A little bit about my background. So I actually was a Chichester University sports therapy student. I think it was about 10 years ago that I graduated actually. So I then went on to work for 18 months within professional football. I then left and got a job as a sports therapist in the Royal Bournemouth Hospital. And then I moved away from that and worked in private practice for 8 years and worked for Great British Diving. So the springboard or platform diving. So I have done a little bit of work for Chichester University for the last few years, but then I went full-time this August. So this is my first full-time year, but I've taught rehabilitation and electrotherapy for the past 2 years on top of that. So I teach both of the rehabilitation modules, rehabilitation return to function, whereby you learn how to take an athlete or a patient from an acute traumatic injury all the way back to being able to perform their day-to-day activities and unrestricted job. And then in the second semester, we focus in on return to competition. And this is where you learn how to rehabilitate your athletes back to being able to do what they need to be able to do for their sports. And it requires you to learn more about how to individualize specifically the movement patterns, specifically how to make those athletes strong, specific for what they need to be able to do. I also teach on, well, Russ and I will also be teaching on the clinical electrotherapy module, whereby you learn how to use 4 different modalities. You learn how to use a laser machine, ultrasound, interferential, and a TENS machine. So you do that in your last semester of your 3rd year. And yeah, students typically, these 4 haven't done it yet, so they can't really comment, but that's normally a module that a lot of the 3rd years really enjoy. We go into a lot of the physiology as to how those machines work, and you come out with a really good understanding, not only how to use the electrotherapy modalities, but how the pain physiology works and how the bodies heal in response to using the electrotherapy as well as other treatment modalities. Yeah, I think that's a bit of everything.
Thank you.
Sorry, my dog jumped on me.
Go on.
My dog jumped on me mid-talk, so I lost my flow. Apologies.
Nathan's House, do you want to introduce your all? Pointy fingers are starting.
None of you were in it, apart from Jamie.
I'm Jamie, 2nd year. I don't play basketball for the uni.
No, you don't play basketball.
I'm Caitlin. Play football. Yeah, I played football, but I got injured. But I'll be playing again soon, hopefully.
And then I'm Nathan. I'm a second year as well, and unfortunately I live with these lot.
And I'm Beth, and I'm a second year as well. That's pretty much it.
We've currently got Amber a lot at the moment.
Yeah, like every day.
Yeah, Amber 4 times a week.
Lucky them, I'd say.
That must be tough, Nathan.
No comment.
That's okay. They've completely forgotten about my module. It's fine.
We've done the exam for your module now. It's
Very true. It's all done.
Yeah.
So just a little bit more about what I teach. So you start with me in first year with human anatomy, and then we have a double module through your second year, where which is where these guys are up to at the moment. They've just had one of their first assessments for that module, and that's mobilizing the spine. So we spend an entire year looking at how to assess the spine and how to move the spine. Now, lots of different sports therapy courses will all follow a very similar track where there's 26 universities that are all endorsed by the Society of Sports Therapists. And we've all got a very similar competencies that we need to be able to meet. But what you'll notice between the different universities is different emphasis perhaps on some of those competencies. So we put our spine module in the second year, and it spans both semesters. Some degrees you will see they put their spine into their third year, and it will only span one semester. Now, the reason why Chichester do it second year to span 2 semesters is A, because we don't want to rush it. We want to spend lots and lots of time. 95% of the population suffer from back pain. So we want you to be able to spend a long time on it. And then when you get into your third year, that is when your opportunity to practice within the sports injury clinics that Carolina mentioned. So those injury clinics, you spend as a third year 4 hours a week, supervised by a member of staff. And you have students and staff that come into those clinics. Now, the beauty is Chichester is a very, very sporty university. There are lots and lots of injuries that happen. And we also have a very, very large dance provision. Now, if you happen to have any friends who are dancers, you know that they often return to dance and then suddenly have 8 hours of dance in one day and are expected to perform that for the entire semester. So we have a clinic full of dancers and also acute injury that you then get to practice with under the supervision of Chichester, of the lecturers. Now, because we are a fairly small institution, we only take 40 students at a time. It means that there is plenty of opportunity to get these clinical hours within your third year. You also have an expectation, as Carolina mentioned, that you will go out and get additional clinical hours within the workplace. So that's additional 140 hours that you do. We recommend that you try and find those clinical hours yourself. However, if people are struggling with that, then we do facilitate that. Now, one question that I'm sure a lot of thoughts are at the moment is regarding COVID and how university potentially have adapted and what kind of things can you expect. And with all good intention, the idea is that with all the vaccines working, that life will return back to normal, hopefully, as soon as it can. But I think we're also realistic in the sense that it's going to take quite a while to vaccinate the world. So it is something that's considered. So what we as a team did over the summer is we have done short video clips of our entire syllabus. So every single clinical skill that you will require has been recorded, and there's 2 reasons as to why we've done those recordings. So one of those reasons is that within class, so you have a blended learning approach. Currently, your lectures have been online, which is why we know where these guys sit in the around their kitchen table, because they've sat in the same places for the entire term. But we have a online lecture for each module. And then you have a face-to-face practical for each and every module. And this has been in full PPE all term. So within the face-to-face, we play these clinical videos, and then that's a resource that you're also able to access in your own time. So what I've put together is I've put just a very short video clip. Now, I will ask Amber to share it in the hope that it does work nicely. But if it doesn't work nicely, then I've just popping it into the chat box now, so that you should be able to also be able to follow that link. Let's see if Amber's works. And this is just typically what we have done to modify for this semester. But there are, like a lot of things in COVID, there are a lot of things that perhaps have been good practice and things that we're going to take on board. We've recorded sessions for years within sports therapy because different people do learn at different points, and lots of people also want to go back and revisit things. So recording lectures is something that we've always done, but this is just additional clinical skills that we've put together.
You ready? Can you all see it?
I can see it.
Perfect.
Cool. Thank you. So I'll just take this point in time, just for now, just to ask if there's any questions that people have that they want us to pick up at the moment. You can either reveal your mic, you can use the chat function, I don't mind, but just anything. And it might be questions that you want to leave to the end, but just checking that there's nothing that people have come up with so far.
So what's the split between practical and theory, like lectures and everything?
Okie dokie. So we have 4 modules and per semester. So we're split into 2 semesters, and so you cover 8 modules an academic year. So for each one module, it tends to be 1 hour of lecture delivery. So currently that's online, but during normal time, that would be a 1 hour face-to-face delivery. And then it's 2 hour practical that you do. Now, our expectation for additional work is 4 to 6 hours of additional study per module. So we're looking at about 16 hours of independent study per week on top of the 12 hours face-to-face delivery. So that's sort of where we end up with that.
Okay.
On the COVID note, would it be, I think it might be worth asking these 4, how have you found the whole wearing of PPE? Have you got used to it? Do you feel quite comfortable wearing it all and doing everything?
Yeah, I think the first couple of weeks are a bit of a shock, but then after that you don't think about it, you just get used to it. It's no different to, the mask is no different to when you just go out to the shop or to anywhere now. Then after that, it's literally just gloves and an apron.
I think we might have only found it weird as well, because in first year, obviously, we didn't have any of that. Whereas for you guys, like, you won't know any different, so it would probably be even more normal.
Yeah.
Yeah, I don't think it's nothing. Definitely not. Doesn't put you off.
It doesn't affect anything. Like,
you can still do everything you can do with apron and gloves on, and you're not disadvantaged by it.
Thank you.
So our idea for the next sort of 15-20 minutes is a little bit of audience participation. Now, what we thought we'd do is we look at screening of athletes. So as well as a sports therapist, you're not only going to be responsible for people who are injured, but also it may be that you're looking to pre-screen patients who may be susceptible to injury, or that's injury as a result of something else that's occurring biomechanically. So what Amber's got is a couple of videos that we're going to watch, and you're going to lead us on that. So I'll shut up, Amber, and let you get on with it.
I'm going to lead it, am I? Okay.
Yeah.
Okay. So the first thing we're going to look at is a fundamental squat. So what I would like you to do is I'm just going to play this video, and I'll possibly play it a couple of times. And I just want you to start looking at the hips, the knees, and if you can see the feet clearly enough on the video. And I just want you to think, well, write down or think about what you're seeing, and then we'll just discuss what you're actually what you are seeing. The four of you can also have a go, can test and see how much you've remembered and learnt. We might need a little bit of help. So
no pressure here then, guys.
If I just play the first one. So look at the hips, the knees, and the ankles. Okay, so if I just leave that there. What did you notice happened at the hips, knees, and ankles? What movements did you see? Were they symmetrical from left to right? Kind of things. You can either put it in the chat function, or if you're feeling brave, turn your microphone on.
They were all like in line.
Were they? What was in line, Holly?
So like the knee was like in the middle of the ankle, like it wasn't turning in or anything.
Okay. Anyone else see anything? Would you agree? Would you disagree? So the female that was being videoed was a second year, and I think that you four may have a comment to know. What did you notice about your friend's squat alignment? Was there anything?
Her knees go slightly inwards.
Okay. Yeah. Should we watch it again and see if you can now notice that? Okay, and then someone from Richard Taunton's has said the range of movement wasn't symmetrical. So what I'm going to do is I'm going to play it again, and I want you to look and see if those knees do stay in line, or whether they do come inwards, or whether, and also whether the range of movement was symmetrical. So seeing if there's any twisting going on. Okay, so I'll talk over the top. I'm hoping you can all hear me.
Okay.
If we just look at it slowly as we're going down, can you see about halfway down, she has a little bit of a wiggle in non-scientific terms, a wiggle at the knee and a wiggle at the hips. Okay, we'll look at it again one more time. I'm going to try and pause it just before. Okay. So if we look at the bar in this position, can you see how there's a lean towards the right-hand side? So the bar's not being held evenly or symmetrically above the head. If we then look at the female's feet, you will just about be able to see that on the inside of her foot on the right side, you can see an arch. So you can see almost a lifting of her foot between the front and the back of the foot. Whereas if you, sorry, that was the right side. But if you look on the left side, you can see that that arch is a lot harder to see. Okay. That then means that her left knee is slightly coming inwards, and that's what's causing that leaning towards the left-hand side. Okay. So if we just go back slightly, now you should be able to see that. Now I've pointed out those things. So we've got the dropping of the foot, the inward movement of the knee, which is causing that wiggle and causing the leaning of the bar over her head. Okay, so she's getting to about 90 degrees, but she has got some areas where her movement does fault. So this next video, what I've done is I've put her heels on a raised block. And we do this to make the movement a little bit easier, to see if by increasing her, by placing her ankles raised, we're able to increase the depth of her squat, and whether this in turn will mean that those movement patterns happen less. So let's see again whether those things have improved. There's still a little bit of movement and a wiggle, should we say, coming, but it's a lot less. Let's watch that again. It's a lot less now her heels are raised. So because her heels are raised, she's able to put more weight distribution through her heels, which means that she's not inverting or losing that arch at her foot, and that means that her knee isn't coming inwards, she's not wiggling, and that bar is now staying smooth. Any questions on that or any comments on that? That was quite a non-scientifically termed movement analysis, and obviously we'll teach you how to go into the depth and learn the scientific terms about what's happening. But could you all agree that when we looked at it in a little bit more depth, you started to see that there was some movement inadequacies? Yeah, good. So I'm going to go on.
Sorry, Amber. So what we do is when you come in first year, you all come in at very, very different levels. So some people have had a lot of anatomy in their A level or their BTEC routes. Some have had very little. Some have had a lot of physiology route. And I think, guys, you probably agree that in those first couple of weeks of first year, there was a real difference in levels, and some people were able to answer questions and some people weren't. And what the idea is that we try and build up the your knowledge base during first year, so that when you get to second year, which is where we'd sort of pitch this at first year and have the same conversations that we're having with Amber now. And then when we get to second year, we start to combine all the modules together. So you start looking at examination assessment, you start looking at assessment skills that you think, well, now I've seen this, now I've identified that I'm good enough at looking, and I can work out that, oh, she is wiggling to the left, and oh, she is loading differently through her foot, or her ankle is changing. And then once you've worked out to look, you then go, well, how am I going to test? And then you take different parts of different modules and then work out, well, if she's wiggling to that side, what's strong, what's weak, what's long, what's short? How am I going to assess the rest of the body to work out, well, why is she doing that? And then once you learn out how to assess and try to have an action plan and a list of what's going wrong, then you start to think, well, what am I going to do about it? And how am I going to fix it? And that's the kind of layering process that we start to put through. Anyone got anything else to add before we move on to the next one? All happy? Go on then, Amber.
Bear with me, it might just take me a second just to get to the right point in the video.
I was giving you filling time and everything.
I know, sorry. I just suddenly thought I should have made use of that time. Okay. So this one we're going to be looking, it will come up after this video now, but it's going to be the inline lunge. And I want you to look at the same things. I want you to look at the upper body movement, the movement that's happening or not happening at the hips, knees, and the ankle, as well as the overall stability. So we'll just watch it. It will be coming up straight after this video here. There we go. Okay, so we'll just look on that side. So what can we see is happening there? Just generally, doesn't matter if you say sciencey words or non-sciencey words. What do you think?
How easily do we think that she performed it?
I don't know if it's right or not, but the knee in the front, so not the one that was behind, but the one in the front, was it slightly going inwards just a little bit?
Yeah, it was going in quite a bit.
Oh, I don't know. It just looked like.
Saying slightly, I think you're being a little bit kind there. Actually going in quite a lot, really. What about her overall stability? Was she stable? Was she moving around a lot? Did anyone notice what was happening to the bar that she was holding behind her back? Was that staying still, or was it moving from side to side?
Didn't seem very stable.
Agreed.
Yeah, Richard, Taunton School.
Okay. You four? Bar was moving side to side. Yes, it was. Famous four, what did you see?
Yeah, we had the same. She has a wobble at the start, especially when you're looking from the side view. The knee goes inwards and the bar comes off the back slightly and moves from side to side.
And what's it called? What's the fancy word for when the knee does come inwards? This is just to test them.
Go on, Caitlin.
Valgus.
Valgus, yes. So her knee is going into a valgus movement, and that's what happens when your knee comes across. So that test looks a little bit more on the stability, fundamentally around the lower limb, but also the ability to be able to stay stiff through the trunk whilst performing a lower body movement. Any comments further on that I've missed? Or anything we want to hear again?
Did the movement look very coordinated? So did it look like a nice smooth movement?
Holly, have a go.
No.
Absolutely.
No, the movement didn't flow. Yes, you're
Oh,
right.
yeah, you're right.
There they all are, thinking they're going to join a call and sit back, and here we are asking questions. It's mean, isn't it? But absolutely, all very, very valid points that we're making. Do we think that we would be particularly happy with this individual going into a very dynamic sporting environment, which was going to involve lots of squats and lunges? And do we think that she may be at risk of injury, if not already? So it might be something that you see yourself. These kind of tests that we do, it might be that you're a sports therapist in a number of years, and you might be going to a club, and you might have to look at a set of athletes or look at a set of players and think, well, what's the team like? How can I assess this team as a and what kind of what prehabilitation might I need to give these players in order to try and attempt not to get them injured this season? So I think sports therapy has definitely changed in the last sort of 20 years, that no longer are people necessarily waiting for injuries to happen, is they're actually trying to ascertain and find out problems that people have before they happen. And you, depending on where you work, as to whether it's in a clinical situation, whether it's with a club, you may have a lot of strings to your bow for the maintenance of these athletes. You also might find that within a sporting setting, that part of your job is to make an athlete strong and conditioned. So you, on top of using these to identify injuries, you can look at their ability to move competently and set them strengthening programs, set them conditioning programs that will then potentially go on to improve their performance potential. So there's a little bit of a fine line in as much as when are we preventing injury and when are we increasing performance? And arguably they happen together. The start point is normally just a little bit nearer to the beginning when we're talking about prevention. But as soon as they've got those fundamental movements and they've got that key quality
biomechanics, then what we want to do is we want to enhance it by teaching that athlete to perform those movements but under load. And when we start to do that, that's when we're actually starting to have a dynamic impact and improve their performance potential for whatever their sport may be.
So other things that you might you get at Chichester is and this term we haven't been able to do it due to COVID, but as a normal response, we have a number of different sports teams. Jamie mentioned basketball, and we have a number of different sports teams that go out throughout the university and compete, and they take a sports therapist with them. So you can either have the role of playing within a team, or you can be the therapist for the team, and you can work in a first aid environment within that team. And then you can refer to the sports injury clinic should you have any significant injuries that happen as a result of that. One other thing I do mention, which hopefully you've managed to see my overview of our degree, which is on our University of Chichester website. But one other thing that we do is we take our students for 3 trips to dissections. So the second year is that you went in your first year, and there will be 2 subsequent trips that they go to, another 3 actually, because there is one at the MSI as well. But we go over to Brighton Medical School, and there are prepared prosections, anatomical prosections. Now, if this isn't your idea of things that you want to do, it isn't a compulsory visit. However, it is an amazing opportunity to have prepared limbs of people who have donated their bodies to science, to put anatomical knowledge into practice. And it doesn't matter how many textbooks you look at sometimes, it's only when I've been going to dissections now for 20 years, and every time I look, the sciatic nerve is separated halfway down the leg in a different place. Some people it's separated right up in the buttock, some people it's halfway down the leg, some people it's split just behind the knee. And it's amazing the amount of anatomical variation that we get. We try and incorporate moving around and using as many models as possible, because it's all very well being able to look at the hamstring flexibility on your best friend, but actually everyone's different and everyone's limbs move differently. So it's important that we also get to practice on as many other people as possible. It's a very, very hands-on practical course. Because we have 40, we are very close-knit, and we get to know you very, very quickly. So within those first couple of weeks of term in first year, you're not just a number, you're a name that's walked into the room, and you're part of the Chichester family, and we keep it like that throughout all the years that you progress. So I think by coming to Chichester, you're definitely joining a sports therapy family that we know even more about each other, because we can see into each other's homes as well.
We know what Caitlin has for breakfast every Wednesday morning.
We have various cats and dogs that join us as we're teaching. The resources that have been made this year, so all the lectures have been put online and all been recorded. And those facilities, even if we go, or when we go back face to face, those facilities will still be available. So if you are the kind of person who likes to listen to content, pause, write notes, everything is now set up for that kind of learning environment. But as I've said, we've always recorded everything that we've done within our lab sessions anyway. So we appreciate there are different learning styles that everyone comes with, and people learn at different levels and different paces. And sometimes it might be that you've come at first year and that the BTEC or A level, you've had a disruptive year, and it's not that you're going to be dictated as to how you came in, it's what you do once you're there. And I must say, Caitlin mentioned earlier that it is different for the second years, because they came in having had a non-COVID year, and then they've had to make adjustments, which they've adjusted incredibly well with. The first years who came in who've known no different, they've had an amazing term. Their level of video engagement, and then their face-to-face engagement, their clinical skills, their practical skills, they've come on so quickly, leaps and bounds. And we come in and we deliver a lot of content in that first year. It's not our fault how many muscles, ligaments, tendons and bones there are in the body. Don't blame me. But, you know, we do take, you are blaming me, I can see you. But we do take you by the hand and lead you through joint by joint. And then we definitely understand that the 3 or 4 years, don't forget, you can make that decision later on. They're taking us foundations and stepping stones. And every skill that we build in first year is then revisited in second year and then revisited, and it's cross-modular. So Nathan, do you want to add anything about sort of your experience of, or anyone in your house, about your experience of what you've had so far? Or back up or deny anything?
Oh, I think you literally said it really well. Like, you do get a lot of information in the first year. And at the start, it is a bit like, wow, this is a lot compared to what you're used to. Like, we all came in on, we had different ways in. Like you said earlier, I did A-levels.
I did BTEC.
You did BTEC.
I did
A-levels.
I did BTEC.
And Caitlin did BTEC. So you are all at different points. So if they are saying things now, like when Amber was talking about, if you missed the knees and things like that, don't worry. Like, they do bring you up to speed, and you do all end up on like the same level. Yeah. But no, I think that the progression from first to second year is a big jump, but you get supported throughout as well. And it's the same, like, from where you are now to where you come in, you will have that help there for you the whole way.
Lovely, thank you. Anyone else other than Nathan? I did just pick on Nathan just because I figured that he would.
I mean, he said it pretty well, really. Other things. It is a big jump, but there's the support's there if you need it, so it's not too bad at all, really.
Could you just give me a bit more information, Jamie, as well, just about the sports and things that you had, maybe last year versus this year? This year's obviously been different, but I believe that a lot of the sports, the idea is that it all comes back in January, isn't it? That the leagues start again.
Yeah, so I think what's happening is that we're joining a league with other South Coast unis. So there's Portsmouth, Southampton, and I think one other as well. So we're doing just an inter-uni tournament, us four, across all the sports. So basketball, football, women's football, rugby, cricket, all the sports are all going to join this league, which should be relatively back to normal, just without people watching, really.
And just a bit about your experience last year in the team sports and a bit about the SU, because I mean, I can't possibly comment on what the SU is or life like.
Amber can.
Me neither.
It was a long time ago, Amber. I'm sure it's changed.
Most teams have training once a week and then games once a week as well, either home or away. If it's a home game, you'll get loads of people coming to watch, regardless of the sport, people enjoying it. So our basketball games often started at 8 in the evening. So what people would often do is they would come to watch our matches, and then they'll all be dressed up in their outfits for the night, whatever each theme is. And then they'll just be almost partying on the sidelines watching the game, and then everyone will just go to the SU afterwards for a night out.
My understanding is that you require a separate wardrobe just for fancy dress kit. Is that right?
I've got some horrendous outfits upstairs. Some of them are awful.
These guys wouldn't have done it yet, but I obviously, when I was at university, just wanted to put in how beneficial I used to find actually being a sports therapist and running onto the pitches and doing some first aid beforehand, and how that builds your confidence and ability to talk to players, assess players under a little bit of pressure. But it's a nice way to do it because you also build a rapport with your team that you're working with, and you get to form friends that way. So second years wouldn't have had an opportunity to do that yet. But I think in comparison to other universities that don't offer that, that definitely is a selling point, in my opinion, of Chichester, because it's good fun and it's educational as well. Until you get to the SU, then it's not so much. But before that, it is.
And I think from a confidence point of view as well, it really does help the students develop their confidence in their role as a sports therapist. So
absolutely,
it's a good thing.
Amber, do you think you could just play that link that Jessica's just popped into the chat?
Yeah.
I think it's the link just for the student union, but I think there's also a YouTube. Let me just try and find that.
I've got my other half's just making his lunch, and he heard when we were talking about the teams, and he said, yeah. So he very much remembers how fun the sports teams were when we were at university as well. He's now gone all shy. Sorry, that's the link that you just put.
Lovely. So within that that link that's up there, there will be everything about the Students' Union, what kind of things that are on, but also things that you can consider. There's the YouTube link of the University of Chichester. There are a number of different videos that we can put up there that are talking about the SU, are talking about many elements of Chichester life. Any other questions that you might have that we haven't covered within this? All quite happy? So thank you very much for joining us today. If you do have any questions, let me just pop my email just in the chat box, that you can more than welcome to email me directly and ask any questions that you've got, maybe about your application, or maybe about further things that after you come off the call you go, oh, I wish I'd asked that. Then quite happy to for you to ask away. Amber, I think you're still sharing.
Yeah, I was going. Are we playing the last video?
Oh yes, Amber's got one last video for you. Sorry, just before I run away. So this is just a video about a day in the life. Golden, golden.
'cause I'm so